Hi everybody, welcome to my YouTube channel. I am Dr. Monica Bartoli for those of you who don't know me, Dr. B for those of you who do, and I am a solo practitioner and owner of my practice, Orion Family Health. Orion Family Health is a house call based direct primary care practice in the South Florida area. I serve mostly Broward County and Palm Beach County for my patients. And I wanted to create a channel on a platform where I could make longer videos to talk about some education, some chronic diseases, talk about the healthcare space, the insurance world, how we got here, and more importantly, where we're going and where I'm going as far as practice goes. So thank you for tuning in. This first video, I'm just going to explain to you who I am, what I do, and my vision, as well as what direct primary care means to me. So again, my name is Monica Bartoli, and I am an osteopathic physician. I went to medical school at Nova Southeastern University, and I completed my residency training in family medicine at Broward Health. After residency, my husband and I moved to Colorado, where I did traditional family practice, outpatient, in the Boulder area, as well as urgent care in Denver. So maybe I look familiar to some of you watching. After 3 years, this Florida girl couldn't handle the snow anymore, so we moved back home to Florida, and I opened my practice on August 10th of 2021. So here I am. Orion Family Health has been a vision that I have had for a really long time. I always knew I wanted to do direct primary care. I always knew I wanted to be my own boss, but I didn't know what that looked like or how to do it. And one day the light bulb went on and I realized it was my time. And so in the middle of a pandemic, I launched my dream practice. And so things are going well. I serve, like I said, most of Broward and Palm Beach counties. And I take medicine and primary care into my patients' living rooms, and that's my style of medicine and how I want it to be done. So some people have asked me, what is direct primary care? And that is a loaded question. So if you want a textbook answer, you can Google direct primary care. There's a lot of websites. There's actually one called dpcfrontier.com. And that's sort of a mapper, if you will. You can go in there, you can put your zip code in, and any practice that has registered with them in your area will show up, so you can find direct primary care resources through there. So direct primary care, well, I'm gonna tell you what it means to me. So simply put, direct primary care is exactly what it sounds. It's a traditional, simple answer to an extremely complex, modern healthcare problem that we have. So direct primary care is the doctor and the patient. That's it. There are no party interferences like third-party insurance companies. Your care is dictated by the patient and the doctor. In traditional modernized healthcare worlds, you have an insurance and you go see your primary care doctor and you have co-pays associated with that. Or you may need authorizations for certain tests or procedures. In the direct primary care world, you pay your doctor a flat rate that you're already aware of, or sometimes you pay a membership fee, and you know exactly how much your healthcare costs with your doctor. My patients all still have insurance, and I encourage patients to have insurance. If you go to a hospital or you need something complex, insurance is there to cover unexpected, catastrophic healthcare problems. But insurance is not always a good fit for quality primary care. So in my practice, the way that I've done direct primary care is I have two options. I have a membership model where patients can become members of my practice. They pay me a monthly fee, and in that monthly fee is all of the services that I provide to them. So for example, they pay me monthly fee, I am now their doctor. Let's say 2 weeks from now, my patient thinks that they have a urinary tract infection and they feel like they need to be tested and treated. Well, they've already paid for me and my services. So I show up, we do the urine test right there in their home, and if it's appropriate, I prescribe them antibiotics and get them treated. Versus them having to make an appointment, call, get on a wait list to try to see someone or go to an urgent care and have to sit in a waiting room for 3 hours. I also offer non-member options. So if I have patients that maybe don't have it in their budget to pay me monthly or don't think that they would utilize me so frequently that it makes sense for them, they're welcome to pay a flat non-member fee that they know ahead of time what everything costs. So if a non-member was to call me and say, hey doc, I think I need a test, I think I have a urinary infection, I still show up at their house, I still run the test, and I charge them the preset house call fee and the urine test fee. No surprise bills, they don't get any insurance claim notification afterwards, everything is settled right there. So that's direct primary care and how I've applied it to my practice. And I find that many patients see the value in this because with a lot of high deductible plans, some Medi-Share plans, patients are already used to paying for their medical care even when they have insurance. And it makes them feel secure that they know they have a personal relationship with their doctor and they've already paid those fees. So there's no extra fees, there's no surprises, they don't get a notice saying their insurance didn't cover something or didn't warrant it necessary. So that's direct primary care. I know I talked a lot about my practice, Orion Family Health. I am accepting new patients. So if you are looking for a doctor like me and you're in my area, let me know. I'm going to create a series of videos that, like I said, talk about where we are in healthcare, chronic disease, health tips, insurance things, financial things for patients. So I would love for you to join that journey with me. If you want to hit subscribe to be updated, you can follow me on any social media platform, Dr. Monica Bartoli and Orion Family Health. We are on Instagram, TikTok, Facebook. We're all over the place. So I welcome you on this journey with me. I hope I provide you some informational content. If you have anything you want to hear about or have questions, drop me a comment. I'll be happy to make a video about that. Send me a message or you can give me a call. I hope everybody stays healthy, happy, safe, and I look forward to being your partner in healthcare and the best doctor that you've ever come across.